Hello everyone, I'm Dr. Jennifer Chen and welcome to my channel. Today we're going to talk about how to prepare for OET writing component. Before I start with today's topic, let me give you a brief introduction about myself. I was a clinical faculty of UTESCA, UT Health Science Center, San Antonio. I was also a clinical faculty at PNWU Health Science, Pacific Northwest University Health Science. Since 2012, I have been a team member and then eventually a team lead of CMDA Medical Education International team. I had a lot of experiences with medical education. I have trained a lot of medical students, residents, and fellows. In the recent years, I have been focusing more on helping with IMGs for test preparation and career counseling. So let's talk about today's topic, how to prepare for OET writing component. OET, it's also called Occupational English Test. It is an international English proficiency test that assesses language communication skills for healthcare professionals. Now, it is required for the IMG candidates to pass the OET test in order to qualify for ECFMG certificate. The test has 4 components: the listening, writing, reading, and speaking components. Listening component is 50 minutes, writing component 45 minutes, reading component 60 minutes, and speaking component 20 minutes. The writing component is usually considered as the most challenging part, so that's why today we're going to focus on the writing component. So for the writing component, at first you will be given case notes of a patient, and also you will be given a task. It will tell you what you're supposed to write, who you're supposed to write to, what kind of letter it is. You have 5 minutes to read through the materials, and then you have 40 minutes to complete a letter. Then your letter will be assessed according to the following criteria. The criteria of assessment are 1. Purpose, 2. Content, 3. Conciseness and clarity, 4. Genre and style, 5. Organization and layout, 6. Language. The first criteria is to write with a purpose. I think this is actually the most important goal for you before you even start writing the letter. You should really think about it clearly and carefully and ask yourself, what is your purpose for this letter? The purpose of your letter should be immediately apparent to the readers, and also it should be sufficiently expanding, which means you need to say clearly in your first sentence what you want the reader to do. Why are you writing the letter to the reader? So that's why the first paragraph, you will need to create an introductory sentence, clearly stating your purpose of the letter. The second goal is choose the right content. Again, ask yourself this question: who is your audience? Who are you writing your letter to? And what is your purpose? What are you trying to achieve? Then you can decide what is relevant or irrelevant information to your letter for your purpose. Then you can decide which ones you need to include in the letter. Make sure you transform the case notes into complete sentences. And then while you are doing the transformation, make sure you keep the meanings the same. The third goal is to write with conciseness and clarity. So ask yourself this question: does the information help the reader to care for the patient? Does he or she actually need this information so that he can care for the patient well? I think this is probably the most difficult part for students and the candidates because I know you tend to think everything is important and you have a hard time to decide which information can be left out. That's why I said in the beginning why purpose is so important. So you have to decide first, what is your purpose? Then you screen out the information according to your purpose. So you're not trying to decide if the information is important or unimportant. They might all be important, but our question is, are they relevant or irrelevant? If it's irrelevant to your purpose, then leave it out. Okay, let me give you an example. For example, what about patient's diet information or PO intake information? How much he's eating, what he is eating. Is it important information? We tend to say yeah, right? We think it's important. But then I'll ask you this question. What if it is a discharge letter from a hospitalist to the patient's primary care? Is it important for the hospitalist to tell the primary care how much the patient is eating and what is he eating right now? How about you're a primary care physician and you're writing to a GI specialist trying to refer the patient? And is it important for you to tell him if the patient can eat, how much he can eat? Does the psychiatrist need to know about that information? Does he care if the patient is eating well or not? What if you're writing a letter now to a home care nurse who's going to take care of the patient at home? Does she need to know? What I'm trying to show here is because for different letters, the purpose is different. So you might leave out certain information because they're irrelevant. The fourth goal in genre and style. So you basically need to know what formal writing looks like and how to write formally. You have to have the right title, the right tone, use facts, not your own judgments, and then you need to start and end the letter correctly. I know you have collected a lot of study materials, so what my recommendation will be is just to read through all those letters and materials so you will have an idea each genre and what kind of style you should have. Then memorize them. I think this one is actually pretty easy to achieve. The next part is organization. I think this part can be tricky too, so let me explain to you what we should do. So different letters are actually arranged differently according to the purpose. See, again, we're talking about purpose. So it's so important to remember to set your purpose first. Some letters are arranged chronologically, so which means you just stating what happens from like day to day or periods of time. For example, if it's a discharge letter, then you tend to group things chronologically and say he was admitted 2 weeks ago, what happened initially, and then how he got better, and then what kind of treatment was given. So it's all chronologically. Other letters are actually arranged thematically, which means it's arranged according to topics. For example, if it's a consultation referral letter and you're trying to refer a patient to a specialist, then you want to arrange all the contents that's related to the diagnosis, to the topic, together. The other question people might have is, where do I put the past medical history? Well, it all depends on what you're trying to achieve. Think about some of the examples. For example, if you have an asthmatic patient was diagnosed with asthma, then in the past medical history, it told you how often he had asthma attack, when was the last time he was admitted, things like that. If you're writing a letter to a GI specialist trying to refer the patient, then the asthma information will serve as past medical history. But what if you're trying to send him to a pulmonologist You're hoping that the pulmonologist will be able to help you with his asthma treatment and evaluation. Then at this time, the asthma information will all be in the current medical information section. Does that make sense? Now, what about history of hypertension? Usually it's grouped with past medical history in the past medical history section. But what if the patient is having acute chest pain and you're sending him to the ER and the blood pressure is out of control? So now, is it become relevant that he has history of uncontrolled hypertension and he's taking all these meds? Again, another example is a stroke. What if it's in the remote past? It's already done and he had no residual weakness. Where should you put that information? Or do you even need to include it in your letter? Now, another example is, what if the patient had a stroke 2 weeks ago? Now he's having right-sided weakness and you are referring him to a physiatrist or physical therapist for therapy. Now, do you need to include the stroke information in your present history? So I hope from all these examples you will realize there is no set rules for where you should put what kind of information. So everything you're writing down has to serve the purpose that you already set in the beginning. Then the last one is to use the right language. I think this one is pretty obvious, and I think if you just pay a little bit of attention, then you should be okay with it and you should be able to master it. It's about grammar, vocabulary, spelling, punctuation. So before you hand in your letter, just make sure you double check and do your spelling check, make sure everything looks good. So if you're only going to take 1 point away from today's video, I think it's purpose, purpose, purpose. So spend the 5 minutes thinking about what your purpose should be. Then screen all the information in the case notes, trying to decide if they're relevant or irrelevant according to your purpose. Then you arrange all the information in a way that supports your purpose. So if they're more relevant, they're current, put them in the current section. If they are just background information for your purpose, then put them in the background section. So when you're writing the letter, keep asking yourself, why am I writing this letter? Am I providing all the information needed to support my purpose? Is the person who's going to read it going to understand what I'm saying and he will know exactly what I want him or her to do? And I think if you just focus on these questions and if you're able to provide the answers to the questions, then you will write an excellent letter. Okay, that's all for today's topic. If you're interested in how to prepare for other components of the OET, please comment below with your specific questions. Then I might consider doing other videos focusing on other components of the test. If you find this video content to be useful, please do subscribe, share, like, and comment. Thank you so much for watching and have a great day. I'll see you next time. Bye bye.